Hello and welcome. My name is Glenn Eden. I'm an Executive Vice President at Weber Shandwick, a global PR firm, and the moderator of today's panel, Can COVID-19 Data Help Us Achieve Health Equity? Thank you for joining what promises to be a very insightful and engaging conversation. But before we get started, I'd like to turn it over to our distinguished panelists to introduce themselves, starting with Dr. Charles.
Yes, hello, and thank you for including me. I'm Wendy Charles, Chief Scientific Officer at Burst IQ.
Dr. Hall?
Hi, my name is Jen Hall, and I serve as Chief of Data Science at the American Heart Association and lead our Institute for Precision Cardiovascular Medicine.
Dr. Nalamuthu?
Hi, my name is Brahmaji Nalamuthu. I'm a cardiologist at the University of Michigan and also a professor of internal medicine here.
Paul?
Paul Watson, so I'm the Vice President of Healthcare and Life Sciences at Hitachi Vantara.
Thank you. Glad to have you all on the panel. And now we'll begin the discussion with some brief opening remarks from myself, Dr. Hall, and Dr. Nalamuthu. As COVID-19 has created an unprecedented and problematic global health crisis, science, research, and data are critical pathways to get us back to a world that is healthier and safer. But how do we know we had a problem? What was the problem? The environment regarding public confidence in science became challenging and complex quickly once the pandemic set in. Suddenly, science was thrusted into the spotlight with people asking questions and looking for answers with more urgency than ever before. The virus was so new, truly novel, that no one knew what to expect. Science about it was evolving rapidly. However, it seemed clear that risk factors, health and racial disparities, and social determinants of health were bringing a higher burden of illness and mortality. Research urgently needed to be accelerated to identify these patterns and port towards findings that could help inform policy, but how? Given that the world of data science is chaotic with many types of data stored in different ways in different places, this is where the American Heart Association's Precision Medicine Platform and the COVID-19 Data Challenge came into play. And now I'll turn it over to Dr. Hall to further elaborate. Dr. Hall?
Thanks, Glenn. I feel that the American Heart Association was really in a very fortunate position to be well prepared for this pandemic. And with our great volunteers, as well as with our collaborators, Wendy and Paul from Burst IQ and Hitachi Vantara, with our precision medicine platform, we were able to bring researchers together with opening of all data and analytical tools to level the playing field to bring as many researchers as we could with as much data, quality data, that we could bring together to answer important scientific questions that we all needed to know about COVID at a time when patients were dying. And so for all the right reasons, we were all prepared to come together and collaborate on this wonderful project.
Thank you, Dr. Hall. And now I'll turn it over to you, Dr. Nalamuthu.
It's a great pleasure to be here and to talk a little bit about our team's involvement. And I want to emphasize that word. I had this discussion with Glenn earlier. I'm from the University of Michigan, and we're all about the team here. This was really an extraordinary effort, and part of it was accelerated by the platform itself. Even in this era of COVID-19 and kind of distributed work environments, the platform was a place where we could all come together. Myself, Ji Zhu, who is a professor of statistics here at the University of Michigan, and 4 of his amazing graduate students. So I'm going to take you back a little bit to March of 2020. And if we can kind of remember that moment, there's a lot of fear around what was happening with COVID-19. It was pushing us in so many directions, both on the science side, and I can tell you being in the hospital on the clinical side as well. And when the American Heart Association started to put out this challenge, pretty soon I reached out to Ji Zhu and started to think about ways in which we could help answer some of the key questions that were out there. The first stage of the challenge was actually providing some really novel data from South Korea, as well as some other sources. And that's kind of what we focused on. And rather quickly, we were able to look at how different policy interventions at a national level in that country might have impacted the rates of new COVID-19 infections. And this was really informative, I think, for policymakers here and elsewhere to kind of really evaluate what types of strategies might work. again, just remembering that this new virus was hitting us, and we had very little understanding of what could make an impact on infection rates. After that first stage, with the second stage, we went on and we looked at a couple of specific areas that were really interesting and we thought would be informative to, again, policymakers and clinicians. And those two were, really tough problems to tackle. One of which was something dear to our heart, which was the idea of how university and college policies might impact on infection rates locally. So I live in Ann Arbor. I'm a professor here, and we knew in late August and early September that a lot of students would be coming back to campus. And so again, leveraging the data resources in the precision medicine platform, we were able to kind of look nationally at how the return of students was affecting local infections. That was very insightful. So as an example, in a county about the size of Washtenaw County, where the University of Michigan sits, we started to recognize that in counties about that size, if they came back with in-person rates, for every 10% increase in the number of students, that would be about 7 new infections a day, especially in the early part after students return back. And then we also were able to discover that strategies like online learning and online courses could actually reduce that rate as well. And then the final thing, and this is home to what you were talking about, Glenn, which is like we've seen extraordinary variability in the infections across the country with COVID-19. And some of those issues are the ones you mentioned: advanced age, social determinants of health. We've seen incredible disparities in communities of color. In some ways, COVID has exposed so much about both our medical and public health infrastructure, with the stress that's involved. Again, using some data that was made available to us from the American Heart Association Precision Medicine platform, we once again were able to, look at how, some core differences in patient populations across this country might have impacted some of the rates of infection. So we know that the distribution of individuals across the country by age varies considerably, and so does the variability across comorbidities too. So that was a really important and valuable insight.
Thank you, Dr. Nalamathu and Dr. Hall. Now I'd like to start off by asking the first set of questions to give the audience a sense of how the COVID-19 Data Challenge came to be and what makes it so unique. And I'll start this question off by asking Paul this. Paul, can you walk us through the process of the COVID-19 Data Challenge and how you brought it together so quickly? How did the American Heart Association, Hitachi Vantara, and Burst IQ work together to define and align on key priorities and components of the Data Challenge?
I think really the Data Challenge was enabled by some key innovations, from the American Heart Association and from Burst IQ. If I start with the precision medicine platform, that platform has really been developed by the American Heart Association and Hitachi Vantara to really look at how you accelerate the whole process of research. So from acquiring data and then making that data securely accessible to global teams of researchers through an intuitive sort of interface and method. And that really, I think, gave us a huge starting point and being able to bring some pace and agility to this challenge. I think the next part is Burst IQ. So really, we'd been talking with Burst IQ about the impact blockchain can have on sharing data securely across regions or organizations. And they had started to think about bringing COVID data sets into their platform, into this research foundry, which enabled us to really tap into a huge network of data in COVID. So it's really by connecting those dots together, we were able to sort of launch the Data Challenge by bringing the data exchange from Burst IQ into the precision medicine platform and really creating a platform that would be able to quickly release that data out for the Data Challenge. I think in terms of the priorities, I think it was really around firstly a shared vision, and really locking that down and testing the feasibility with all parties. And everyone was really responsive to this, and it enables us to quickly move on to looking at technical feasibility. I think within days we had connected the two tools together and we were starting to show that we could actually bring this Data Challenge to life. And from there on in, it was really the AHA which really navigated us through, actually launching the research, engaging their community, and making this happen in an incredible time frame.
Yeah, truly rapid. Next question is for Dr. Hall. Dr. Hall, how does the data challenges approach compare to more traditional methods of fueling scientific research and funding support?
Well, it's all based on great science, and so there's similarity there. The difference is that we're asking researchers like Brahmaji and his team and others to come to us with their solutions. We're opening up data to them. We're bringing the researcher together with the analytical tools and giving a level playing field to everyone, whether they be in Kentucky, inner city, and they have access to data or not, whether they have access to the latest software, machine learning, analytical tools, artificial intelligence. We're giving everyone a level playing field. And that's a significant difference with the data challenge. And secondly, they're coming to us with solutions. And at the end of the day, that's what we all need, especially in a pandemic, is a solution to a problem. And with all the data that we've opened up, thanks to Burst IQ and other data sets that we had available on the precision medicine platform, we were able to not only test hypotheses and different solutions, but more critically test them, because the wealth of the data that we had brought significant numbers. And so the trust of the science really shone through, and we were able to do it in a remarkable period of time.
Outstanding. For the next set of questions, I want to zero in on the data challenge and its findings through the lens of equity and potential use for policy makers. This first question is for you, Dr. Malamuthu. As a clinician, and as you just reflected on where we were last March and now today, what light do your findings shed on the key intersections between COVID-19 and social determinants of health?
Our findings did show that there is an incredible distribution of risks that we know lead to COVID-19. So one of the data sets that was made available was the IBM Market Scan data set. A lot of healthcare claims data across pretty much the entire United States, insured populations. And what we were able to determine from that is, like, when you look at some of the 10 key medical conditions that the CDC had outlined as being kind of risk factors for COVID-19, not unexpectedly, those risks are not the same across each community. Our findings kind of just fed into like what has been an increasing body of research that's kind of suggested the same thing. As I alluded to earlier, COVID-19 has been a challenge in so many ways, and it continues to be a challenge, honestly, as we try to, work our way out of this. There's so many great things that we saw, so many heroic things, but I think we also saw some of the fault lines that we have in our healthcare system. And again, it's just opportunities like this, where data are made available, where the science is made open, where other folks can try to get into and answer questions that might be more locally relevant to their own issues. I think this is all a great thing. I just want to, emphasize a couple things that, just really jumped out at me during this whole process. One of which is that, the transparency of the precision medicine platform was really a remarkable thing. So just so everyone knows, when we put up our, solution, as Jen had said, it wasn't like a paragraph that we put up there. We put up like all our code, put up all our analyses, and that's what was evaluated, right? So on the other end of it, the judges were able to not only see what we had proposed, but they also saw all the work, right? We were showing our work. And that was a really powerful thing, especially in the urgency of the pandemic. And we know there's other examples, the Surgisphere example that hit the scientific community last year. And those of you who don't know, where there was data that was released that suggested there was harm with certain therapies in COVID-19, but it turned out that those data resources were not very accurate. They were not very reproducible. And a couple of very major papers had to be retracted. And that really hit the community pretty hard. Because I think the second point I want to make is in the urgency of a pandemic, sometimes we make the mistake of thinking, oh, any data is better than no data. But that's not true. Bad data is not as good as no data. And I think, having the ability to share data, but to share it in a transparent and open and reliable way had a huge impact, I think, in this particular venue.
What are some top-line examples of how the data challenge can be leveraged to help policymakers take real-time action to effectively fight COVID-19? I mean, your research really just hit so many layers of just everyday existing in life. And so just wanted to just get a sense from you on how we can really help inform policy.
Like with most science and stuff, sometimes it's best to kind of target things that are specific and actionable. So as I mentioned, out of all the things we worked on, one of the things that got us most excited, and part of it's because of the community and local issues we deal with, but was that issue of how do we get, kids back to college and universities in a safe way? And what was really exciting for us was to find that, the association, because I think it was something we were noticing. I mean, we were seeing reports come out in the New York Times, like anecdotes and kind of journalistic stories, and to kind of support what was being described in a quantitative and specific way was kind of, I think, an important step. The other thing, too, was to also discover that some policies that had some controversy around them, right? For college students, the idea of online classes and courses, I mean, nobody wants to come back to Ann Arbor and sit in their dorm room. I mean, I can tell you that's hard when you're 18 to 22, but to be able to kind of show that there's a potential for that to mitigate some of the effects of the virus, I think that can kind of inform policymakers, administrators in terms of how to do this in the best possible way, and in the safest way, not only for the kids on campus, but even the communities that surround them.
Absolutely. The next question I'm going to ask Dr. Hall, it's a subject that's really near and dear to me in the work that I do in my day job. But Dr. Hall, why was it so important for the American Heart Association to mandate the COVID Data-19 challenge through the lens of equity and diversity?
Well, science is the foundation of everything we do with the American Heart Association, and we have a real focus and attention to social and structural determinants of health. And we owe that to every individual across this entire globe. And that is because our mission is to be a relentless force for longer and healthier lives for all. And we recognize that, in the past, we perhaps all haven't done as good of a job as we could have done. And I think science sometimes, we're all about breaking down silos in research and data. And we can talk about that in terms of social and structural determinants of health and those scientists that work in that area versus scientists that work in clinical science. And to get them to speak to one another and to begin to understand these problems with a wider lens. And also, as Brahmaji was saying, to bring it to the communities. We have boots on the grounds in all of those communities, and the trust is in the community. The trust doesn't come from up here. It comes from those in the community that have spent the time and effort building those relationships with all of those individuals. And it's going to just take time, and we all have to understand that. It's not going to happen overnight, but we're certainly committed to it at the American Heart Association.
Absolutely. It certainly is a journey, and that was well said, Dr. Hall. And the last question for you in this area is going back to policy making. How do you ensure that this type of research is shared with those who are setting healthcare policy at the municipal, state, and or national levels?
Well, we're very fortunate at the American Heart Association to have an incredible advocacy team that works on the Hill, that works in every community across this country, and really focuses on policy. And so we also have an incredible communications and marketing effort to help get the science to where it needs to be in the hands of the public, as well as leadership to help make these changes. And like I said at the beginning, science is the foundation of everything we do. And that's where the foundation of those policies need to start to change. So we don't do it alone. We do it with all of our incredible volunteers and other other organizations, which we're very proud to be a part of.
Thank you, Dr. Hall. For the next set of questions, I'm going to call on Dr. Charles and Paul. These questions, I'd like for us to take some time to immerse the audience in the intersection of research and technology in a practical and modern way. So, Paul, this question is for you. It's a couple of questions here. The precision medicine platform is the key that activates the data challenge. And so what happens when you log on, and what new technology, tools, and functionality does it leverage that weren't available to researchers in the past?
The thing that makes the precision medicine platform different is to Dr. Hall's point, it's really about creating that level playing field. When you log on, anyone in the world can log on to the platform for to begin with. And when you log on, you get to view all of the data assets through quite a sort of simple and intuitive user interface, which allows researchers to quickly sort of search and filter for data sets that might be relevant and support their particular area of expertise and science. That's really quite important, right? Making data accessible in a way that's understandable and really opening the lens on the data that's out there. I don't think there's anything unique about that. I mean, people have been using, portals to search for data for quite some time. It's what happens next, for me, that is really makes a difference with the platform. And that's it, the way it controls the security and access to data. So as people request data, it will automatically orchestrate the approval process to make sure that the request for data is, sound, it's ethically sound, it's, the data owners have a view and can quickly, approve their access to that data. The next thing that goes on is it then not only gives them access to the data, but it gives them a tool set in the cloud, and it loads that data in there. So all of the provisioning of the tools that are used by researchers for machine learning, artificial intelligence, to draw those insights out of the data are then automatically provisioned and can be accessed by, a community of researchers wherever they're located in the world. So for me, it's the end-to-end story about how precision medicine platform actually seeks to accelerate that entire process, which we've seen take months in a traditional sort of setting, and really the PMP can bring that down to hours and days, and that's really what makes it different.
Yeah, it's really, really unique and exceptional. So, but what are the biggest challenges of sharing data, Paul?
So I think there are many. I mean, we've touched briefly on some of them. Siloed data, data sits in many different places within organizations, so that makes it difficult to access. I think even when you can access it, it's not easily understandable. A lot of it is, technically worded or technically coded, and figuring out how to join data and actually get purpose out of the data is very difficult. The next key area, and this has been touched on as well, is really around security and privacy, making sure that data is accessed for the right purpose. In a traditional environment, that can often be a manual process of filling in forms and waiting for people to respond. And even when that data is then made accessible, actually not everyone has access to the tool sets to work with that data. All of these things make data sharing, inhibit data sharing and inhibit, people's ability to work with data in an effective way.
Thank you very much, Paul. Dr. Charles, your turn. I really want to dig in on blockchain technology. It is very intimidating and scary for some. So just want to ask you, what is the role of blockchain technology here, and how has Burst IQ seen data sharing and collaboration increase in general as a result?
Unfortunately, we don't have enough time for me to teach what blockchain is, but specific to the data challenge, Burst IQ platform stored the COVID-19 data sets and data sets pertaining to other health and environmental conditions. Researchers could use the data sets provided or upload their own data sets and specify who could access their data. And where the use of blockchain was particularly instrumental with the precision medicine platform is that the technologies allowed researchers to aggregate clinical and non-clinical data sets to build multidimensional profiles of patients and health conditions. And together, the technologies and their governance frameworks enabled secure data exchanges and trusted data to allow more confidence in the solutions. And how has data sharing collaboration increased? I think we're all familiar with the fact that researchers are reluctant to share data for which they had made a financial and professional investment. And institutions are also protective of data that involve health information or require additional regulatory protections. But we find that data sharing and collaboration increases when organizations can create compliant data networks from which they or their patients could specify uses and access to data at any level. So from a single data point to petabyte data scale sets without losing control over data. Use of a blockchain in general can add features such as like automated data uploads and mapping, data immutability, audit trails, and allow collaborators to connect their statistical software directly to the platform in the precision medicine platform, instead of downloading data set and sending to them. So overall, the additional control and the trust of the data in this data challenge leads to more sharing.
So how do we apply a more modern lens to how we conduct research, and how do we keep it with the ethical lens in place to use technology and research for good?
Oh, thank you for asking that question. And that touches my heart as a former IRB manager. Most research is still done using 20th century methods for data collection, data management, and analysis. But, in 2021, there are so many more technologies and innovations available that allow us to conduct research in more creative ways. And what's particularly exciting for me as a scientist is that blockchain is facilitating new ways of conducting research, especially virtual and participatory research methods that can reach underserved populations more effectively than we had before. And to ensure that we maintain an ethical lens, the goal is to ensure that we're putting the interests and needs of research participants first. And so this involves asking questions such as, how do we design research of greatest interest to those patient communities? How can we give patients more control over how their information is used and allow them to change their minds? Or how do we ensure that there's strong security for health information or other information that participants may consider to be private? And so where there are newer technologies such as blockchain, and I would include the precision medicine platform, they can provide more respect for individuals by providing more control, more visibility into how information is used, and really more efficiency and security in the whole data management process.
Thank you very much, Dr. Charles. That was very insightful. And I think it's a good segue into our last set of questions that examine where do we go from here and sort of a look ahead, if you will. And so first question will be to you, Paul. What do the overall efforts of the Data Challenge signal about the intersections of science, tech, data, and healthcare looking at a post-COVID world?
What the Data Challenge really shows is that data is transforming, the way that, we can address many problems in the world. And it's certainly true that, all industries are changing through data and analysis and science. The Data Challenge really showed how powerful technology can be. Today in the world, there are, lots of companies leading in that space, but there's also a lot of imbalance in the industry around, who's got access to those platforms and tools. And I think it's, we spoke before, we need to resolve that imbalance, and we need to make sure that we can provide greater access to these tools so that scientists around the world in different settings can work to solve problems in all areas of healthcare. So whether it's health inequalities, looking at new models of care, looking at how to drive more efficient healthcare systems, actually that sort of power of data and the ability to access tools to draw those insights is accessible to all.
And to follow up on that, Dr. Hall, I'd like to ask, how can we apply this to other research in other industries?
Well, I think the model of the Data Challenge is a great one. And I think the ability of bringing tech and science and real world data together is a way to do that, whether that's in finance or, finance is usually way ahead of science in many, many ways with many things. But you can think about it in terms of healthcare and patient outcomes. We have a COVID registry today. We have real world data with over 10 million individuals, and we're opening all that data up. We're willing to do that to improve patient outcomes, because if we can disseminate that data, get researchers' eyes on that, provide better documentation, like Paul was saying about that, that's clickable, like Wendy was saying, that, we provide individual researchers the tools that they need in this day and age. Research is changing. It is not on your wimpy laptop in your laboratory in a silo anymore. It is about collaboration and, building data sets together to find the most critical tests of hypotheses, and data challenges like this, where Ramaji and his team brought an incredible team together. I think more data challenges like these and sharing of code, I think that's the other thing that Ramaji pointed out, this transparency around the data and the ability to replicate and validate just lends more trust to the things that we do, and will bring more transparency to our area of science and research, as well as other areas. When we come back to social determinants of health, race, and equity, things that are dividing our country right now, the more transparency we can bring around all of those things, the better.
Thank you. Well said, Dr. Hall. And that's a great follow-up for Dr. Nalamuthu. So how can the Data Challenge help provide improved access to researchers and clinicians like yourself around the world, especially as it relates to advancing research and innovation in a pragmatic and equitable way?
Yeah, this is just such a fascinating discussion to listen to kind of all of these wonderful and different perspectives. There's an old saying, you never want to wait a crisis, right? And COVID-19 changed a lot of things. It changed a lot of things in healthcare through televisits and virtual healthcare services being implemented, to the science of healthcare, right? Our team is reorganized and done things so differently. And a lot of that is going to stay, because a lot of that has been for the good. All the things that folks had said, we've been talking about for a decade, about how healthcare has been behind the 8 ball from like the finance industries and others. And that has really accelerated. The COVID-19 data challenge of the PMP is just one example. And I'm sure that, Jen is trying to think of other ways in which we can start to, grow this. And she's already been thinking very creatively about bringing other data assets onto it. Again, to really, as you had mentioned, level the playing field, let more people get into the game, and to do it in a transparent and open way. I'm looking very forward to the fact that, like, all those things that seemed so hard to do a couple of years ago have now suddenly become a lot easier. And I don't want to have an awful pandemic as we just did to kind of push that stuff forward, but taking advantage of these lessons that we've learned in the last 12 months to create a sustainable way forward in how we change research, I think that's really possible. I will say I have one complaint about the PMP. Unfortunately, after we won the Grand Data Challenge, we had to have our beers to celebrate over Zoom. And so while this has been great, I can't wait to get everyone back together again and to celebrate in person too, because there's some things that I don't know, maybe Jen has figured it out, but I think having people together still is meaningful.
A beer-fueled brainstorm and celebration is always good. So, Dr. Hall, I've got to ask for this last question. What does the next edition of the Data Challenge look like?
Well, we have launched a heart failure data challenge. And much like the COVID data challenge, we have asked researchers across the globe to come together to bring their solutions for how individuals with heart failure are impacted by both social and structural determinants of health across all races and ethnicities.
We definitely look forward to coming back to having a discussion about that and the outcome. This concludes our discussion for today. Please join me in thanking our esteemed panelists for their time. If you'd like more information about the Precision Medicine platform, please visit precision.heart.org. Thank you so much.